to the master sabi people them. Dr. Mafudia Suaray and Nurse Inez Kaye. Now this program well body na gently. Mr. Coco Pandoramitas.
Then the most common symptom the way them picking that they go with now hospital. Now, you know, the hand and the foot then they swell, that they get pain, that they get bone pain there. And it's in the way they kill them, you know, now infection then like malaria, other infection the way they cause fever, and the anemia where then blood they dump and then where it be say they need transfusion, otherwise they will die. So the important thing where you born picking, even if you don't know waiting at your own status, whether you get sickle cell trait or not, but if you born picking, they get them sick, so in body they ask, they complain of pain, in hand and foot then they swell, in eye they look white, you know, say you not get blood. So important to make them go to hospital, make them go test them, because that picking day, if you get infection, it will quick for me that picking day, you know, die. For you, Dr. Kpakiwa, I will not want to let you come on at this conversation. I know say you don't listen. You know, possibly the born in a Salone, you get sickle cell, and you know, and you don't spend beaucoup of your time also in Germany. And I know say you don't spend some time in a hospital with sickle cell, you know, issues there, you know, pain and things like that. Me Nayana, well, I did in America, I don't take care of beaucoup people, you know, beaucoup young people that will get sickle cell. And I know say that connection there between the doctor or nurse and the sickle cell warrior there, sometimes they ikimona, because all man understand this sick, yeah, so all man understand where possible sickle cell get crisis, waiting really down the time like. So you can share for we what you think say important for me people there, medical people there, where they take care of, you know, somebody with sickle cell. What's important for me they understand, but where somebody with sickle cell go to the day in pain, you get some kind of crisis. What we need for understand. For me, we make sure say we they do well, we they do the right thing for help the person.
Yeah, okay, thank you very much for this question. My own situation kind of weird because I get both sides. You know, I mean, a sickle cell patient, I don't treat sickle cell patient and back, and I know the challenge. I even understand the challenge in them from both sides. I mean, one of the main things that which you don't already mention, say, beaucoup doctor, they don't really get that much understanding. Yeah, well, it depends on also you. It depends on how the population of Black people and they maybe like Germany, beaucoup no get that understanding. And we doctor there, we get one habit. We not like for admit say we not understand something, you know. So I think that is the first thing for listen to the patient and for go educate yourself a bit more if you don't know yet, basically. Then the next step where I think is really difficult now, the way we they view the sickle cell is basically not just some small collective of people there where maybe not really important. Most of them are picking there. Because if you compare them to other sick there, where they cause then the same kind of complication there, you know, like Foodie, you don't make a show but myocardia, you heart attack, you know, where people they know they get blood now they heart, yeah. Then it can be something with sickle cell patient where they get crisis they get.
Mm-hmm.
And we all know say or stroke, then this can be something with sickle cell patient they get, we know that. And the urgency with which then go treat them and then I so for example, the dot to needle time for where you get stroke for be 30 minutes if you don't get your first treatment, then they apply. So why? I mean, we really need foresee. I think the doctor they need foresee and difficultly say this crisis, this painful crisis, it can be say it cost this person in brain, it cost this person in heart, it cost and some joint in bone, you know, the bone then can die sometimes the way blood not they go through. So like how then you say time is brain, time is muscle, and then and so time now all thing for that person there for person who gets sickle cell. So you need for take them seriously and treat them. And the second thing is this issue with pain, yeah. I mean the treatment inside during acute crisis, I sure say Dr. Bago tell him over Dande. You get for hydrate the patient well, you get for make sure say you stop this pain, yeah. You can get oxygen in some cases if you get them, but this pain need for stop for me for try for stop this crisis as soon as possible, because as the longer it takes, the more likely say the patient they get more complications. Yeah.
Mm-hmm.
And the pain a big issue, because sickle cell patients then can need large amounts of painkillers. The doctor they know they understand. I mean, me don't there, so I don't go hospital where doctor don't then tell me say me na junkie more or less because I want painkiller. And
Wow.
that and me they in the position where I able to tell and say, okay, you know what's in, look me on medical ID card. Now this hospital I work, I get access to all the opiates there where you need for give me now. If I want Tifa, I go Tifa and they. But me get that chance for talk down in I also because I get down there. But where the person we get sickle cell, we no get down there. Yeah.
Mm-hmm.
So the old thing with it, you know, the strong painkiller there can be sometimes so problematic. And the thing is, if you treat her well, you free this person from in pain. Usually, like at least for me, like after 3 days, I don't find back. Yeah, I mean that the pain crisis done, and then I can go back to getting recovery. So I think that's really important. And as long as I mean, doctor don't get issue with this thing with this old pain and giving painkillers. We not get any other way for measure pain past waiting that patient is see. So for now, believer where they get that pain day and treat that pain day till say yes, the pain done better. So then the most important thing we want give we can to our medical care provider them for take care. Yeah. Then good. I don't know like me, since I did on hydroxyurea, then other treatment, then they reduce good. It's expensive. I don't know if access it to that in a Salone. But the crisis then they reduce it, they control, they get beaucoup benefits there with unproven. So picking the way they get and they frequently, then they say for be option for consider early for give them for made they able live pretty normal life.
You know, you bring on some very excellent and powerful points there, and me they practice, the Sawa they practice na USA and New Jersey. We get a good number of sickle cell patients there, and at the same thing that they tell me, and at the same story that they explain, now the same frustration then get for some people they know they believe them with and say that they in pain, that if they're gonna emergency, that they wait stay before somebody go even pay attention to them, before they go prescribe the medicine, before they go give them the first pain medicine. There goes there Sunday hours they in severe pain before they go begin get treatment. So you bring very important points there where even when at the diaspora, the advocacy for better care for sickle cell patients are important. On the Salone end, it probably now more people they recognize what even at the sick way they cause all length here. So for me, they even go get the treatment. Then we know what's at the sick, we still the delay for give the right treatment. So the people that we get a very important point.
Listen to this program. Listen to this program. Listen to this